We sometimes see some people having this persistently red cheeks, and we get confused with acne, sensitive skin, allergies and even sunburns. This is actually a condition called as rosacea. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist, NEA Dermatology and Aesthetics. Today let us understand what rosacea is, what are the various factors contributing to this and how we can treat this condition. Rosacea is a chronic inflammatory skin condition which usually affects the face. Here we notice redness, flushing, prominent blood vessels, sometimes even acne, pustules on the center part of your face. This usually affects your cheeks, forehead and even chin. This is a chronic inflammatory condition and it is not acne or it is not a fungal infection. The exact cause for rosacea is not known, but is mostly because of an immune reaction, hypersensitivity reaction, and also because of certain microorganisms like Demodex mites and some factors like your skin barrier functioning and how sensitive your skin is. The most important triggering factors for rosacea are heat, sun exposure, eating hot and spicy food, and sometimes even the products that we put on our face. There are different types of rosacea, the most common being persistently red cheeks, which is worsened by exposure to different environmental triggers where the redness increases, you might have burning and itching sensation. The second common type is when your rosacea is mixed with acne, where you also notice some papules and pustules on top of your rosacea. And number 3 is when your rosacea affects even your eyes. This is called as ocular rosacea. A very uncommon type, number 4, is a phymatous rosacea, where people have thickening of skin. It's most commonly seen in males where they have a very big nose because of thickening of their skin. Some of the everyday things that can worsen your rosacea is most commonly being your food intake, hot spicy food, exposure to too much of heat, that is be it your weather or if you're someone who's cooking and is in front of the stove, and also some other factors include dust, pollution, harsh skincare products that has a lot of fragrance in it. What not to do if you have rosacea is to avoid all of those triggering factors I was talking about. Completely avoid your salon procedures like your waxing, threading, steam, facials and different kind of products they use on your skin. And other most important factor to consider is to visit a qualified dermatologist if you have persistent rosacea that is symptomatic. So when you visit a qualified dermatologist, depending on the severity of the condition, the treatment can contain topical creams, certain oral medications or even laser treatment. One thing you need to understand is there is no permanent cure for rosacea. Avoiding the triggering factors and using certain creams or medications depending on the severity can keep the condition under control. So when you visit a qualified dermatologist, depending on the severity, some of the topical creams they might suggest can be metronidazole based creams, niacinamide, azelaic acid and even brimonidine gel. But if it is more severe, you might need oral medications like antibiotics or even isotretinoin based on the severity. And some of the in-clinic procedures that will help you treat rosacea is number 1, IPL or intense pulse light treatment, which will take care of the redness. And sometimes we might also consider pulse dyed laser, and when somebody has that thick skin, we might consider a CO2 laser. A simple skincare routine that helps in managing your rosacea is number 1, your cleanser. Please choose a gentle skin cleanser that is pH balanced. Do not use any harsh cleansers that has salicylic acid or lactic acid in it. And number 2, a mineral based sunscreen. Avoid the chemical sunscreens, and something which has SPF of 50 plus and PA 4 plus. And number 3, a good moisturizer that can be used during your daytime and even in the nights. And also avoiding all of those triggering factors that I am talking about is the most important factor when it comes to the treatment of rosacea. Rosacea is a chronic condition which can affect the quality of life of the person who is affected by it. Please visit a qualified dermatologist if you're not understanding what exactly is the reason behind the stubborn redness on your cheeks. Once the diagnosis is made, it is very easy to treat the condition. If you like this video, please share it with your friends and subscribe to my channel.